Hi, my name is Gracie McCormack, and today I will be demonstrating how to perform a packed cell volume and a total protein. First of all, you will need to make sure you have all of the equipment required. I will be using a blood tube mixer, pen, paper, a refractometer, sharp spin, lint-free tissues, microhematocrit tubes, putty, the blood sample, centrifuge, and a referencing grid for the total protein. The sample that is being tested was collected from a 2-year-old canine via the jugular vein using a 3 ml syringe and a 23 gauge needle. This collection method was chosen as it was the most convenient vein to use for the sample volume required to run the requested blood test. After the blood was taken, it was then stored in a purple top tube containing an anticoagulant called EDTA and placed on a tube mixer. This was done to maintain cell morphology. Although this blood tube is not labelled, best practice would be to label the blood tube with the patient's name, sex, and age, as well as the date and the clinic name. Wearing gloves, take the blood sample off the blood tube mixer and remove the cap. Insert a plain microhematocrit tube into the sample, holding the sample tube at an angle, and fill the tube to at least 3/4 full using capillary action. Once this is done, place the finger over the top end of the tube and remove it from the sample. Then plug one end of the tube with the soft clay putty. Now place the tube into the microhematocrit centrifuge with the clay plug against the rim. Make sure to balance the centrifuge out by placing another tube directly across from the first sample. Now screw the inner safety lid down over the samples. Set the centrifuge at the microhematocrit setting. This is the fastest setting for 5 minutes. Once the sample has been spun down, take the tubes out of the centrifuge and remove any excess blood that may remain on the outside of the tubes. Now place the tube against the referencing grid with the sealed end downwards. Align the bottom of the red blood cell layer with the 0 line on the grid. Move the tube across until the top of the plasma is lined up with the 100% line on the grid. Now read the level where the buffy coat sits and record the PCV, or packed cell volume, reading correctly as a percentage. To perform a total protein, or TP, break the microhematocrit tube above the buffy coat. Now place a drop of the plasma on the glass plate of the refractometer and close the cover. While holding the plastic cover in place, point the refractometer towards a strong light source. Focus it by turning the eyepiece and read the levels given. After performing these procedures, record the results on the patient's computer file. Finish off by cleaning up the area by placing all equipment away, including any sharps such as used, intact, and broken microhematocrit tubes in the sharp bin shown in the beginning of the video. Finally, spray the bench down with F10 and wipe over with a paper towel. After cleaning, remove the gloves and thoroughly wash hands.